Good morning, everybody. Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare, and the Healthitude Academy. It's not real early this morning, but it's kind of early. Anyway, I am doing Ask a Frustrated Nurse. This is episode 20, and let's just dive in. So I've ventured off of the hospital facility news. I'm in the payer issues. And there's a few things in here that kind of rub me just a little bit. We've always talked about universal health care, and that's the way to go. And I'm not talked about it because I know our healthcare system is broken. And I'm going to liken this to you to give you a little bit of perspective. My best friend and I are polar opposites in our political beliefs. And I don't understand how we are that different. But having said that, the one thing that we can fairly safely discuss is healthcare. And while she leans towards the one payer, I lean towards free market and just throwing the old away and starting over kind of thing. Let these insurances play if they want to, but they would definitely have to clean up their act. And there's a lot of opportunity for just rejiggling the whole state of affairs. And like I said before, I'm a proponent of having a catastrophic plan and then something maybe interim that takes care of your everyday needs. And I mean, there's a lot of opportunity to simplify things, and then just having your dollars that you use how you need to use them. So we've always had this discussion. I mean, I've always said in our discussions that as they push for universal health care, I've always said that United Healthcare is trying to align themselves. And every once in a while things pop up. I'm like, oh, yep, there they are again. And there's a lot of big players out there, don't get me wrong. There's the Blues, for all lack of a better other umbrella statement. Whether it's Anthem. Oh, by the way, Anthem is looking to rebrand their name, but which is a blue. There's Blue Cross, there's Blue Shield, there's Blue Cross Blue Shield, there's on and on and on. So I'm not saying United has always been the largest, but they've done some things through the years that lead me to believe that that's what they're trying to do. This one article I'm looking at, it's from the 17th. So I'm a little late in delivery, but United Healthcare is not happy with the Justice Department. They're challenged to change the deal. And I went to read what the deal could possibly be, and lo and behold, they're wanting to buy Change Healthcare. Change Healthcare is an AI software-based firm and another entity that taking it on as United Healthcare just adds another layer to their tool chest. I was going to say army, whatever. But they already have Optum, which is one of the big things that publications for all of the coding and all of that stuff. So I just saw that and went, And it's $13 billion that they're going to buy this thing for. I'm not overtly impressed with Change Healthcare from what I've read on it, but I'm not a United Healthcare fan, so there you have it. It's just another layer that here's a health insurance company with a lot of other things in their tool chest besides the art of insurance, which my theory is, do something well and be happy, but no. what's the other one? Florida Blue, which is a Blue Cross. They're starting a in-home primary care. They're partnering with a Franklin company. A lot of stuff happens in Franklin, Tennessee. Can I just tell you when it comes to healthcare? It's called Imcara Health, to offer house calls to primary care providers, from primary care providers to members throughout Florida. I'm not saying that's a bad thing. I'm just, Cigna sued for alleged non-payment of chiropractic services. What was the other big one? Oh, here's one. Uninsured Americans could now pay up to $195 for COVID tests. Well, I'm seeing that there's some insurance payers that you're paying a piece of whatever they're billing, which is nothing new, which is a little insane. Having some data breaches. 5 payers data breaches over the last 6 months. That was done Friday. Blue Cross Blue Shield of Kansas, Highmark Health, Priority Health, Oscar Health, and True Health. All of these are Bright Health is another entity that they're laying off 150 workers. Also the and as I think I reported, the California Universal Healthcare bill died before key votes, which is a good thing. Of course, they've already kind of got their own little universal health care, because so many people are on Medicaid, and that's exactly why the state is in the state that it's in. And I'm not saying I'm not denying people care. I'm just saying there's so many bells and whistles and so many rules that, make it easy for people to be on Medicaid. Again, I'm not saying good, bad, or ugly. I'm just saying that there's no incentive. There was another big thing that I read. Oh, big one. Yeah. I can't find it right now. But Blue Cross Blue Shield of on the Florida primary home care, that's Medicare, which is, I think, is really a good thing. Where is it? Texas. Oh, here it is. Blue Cross Blue Shield of Texas. Memorial Hermann sever contract affecting 100,000 members. Now, I have some opinions here. I'll probably try and be diplomatic. This is Memorial Hermann is not innocent in and of themselves, as well as Blue Cross Blue Shield. So apparently they didn't negotiate a contract happy enough for both of them. And they have a system of 3,000 physicians and 265 locations, which now put members out of network. So people can't go, if you have Blue Cross Blue Shield of Texas, you cannot go to the Memorial Hermann group. On one hand I say fine, because they don't play well anyway. They're they're ones that have been known I'm not saying that they're one of the worst, but they have been known to balance bill. Their charges are crazy. They're not real good with cash self-paying patients. So on one hand, I'm like, okay, fine, you guys deal with it. That's what you get. But on the other hand, you know, again, I feel bad for the members because again, you've gone out and chosen a provider to take care of you, which I'm more and more thinking there's some great doctors in these groups, but and I like to see more of them jump ship and go back to private practice and do direct primary care, but they've made that choice and they're in these hospital systems, and I feel bad because they're really great physicians, but you know, they're kind of at the mercy of the contracts and stuff, and this is what happens. You know, they lose 100,000 members. That's fine. I guess they can afford it, clearly. So, you know, we'll see where that goes.